Hello, welcome to BEH 101, Introduction to Behavioral Health. Today we'll be discussing confidentiality, informed consent, and behavioral health skills. Behavioral health professionals must first gain insight into their own values and belief systems so they can understand how they will influence the impressions clients have of them. What we mean by this concept is that how we are perceived by the clients is their reality. And the impression we make is going to define how the client sees us, at least in the beginning. So it's important that we understand that the impression we make becomes the reality that our clients have of us, and we need to be able to control that. Informed consent means that the behavioral health professional must disclose to clients the nature and risks of the counseling relationship prior to engaging in these services. And we're going to talk a lot more about the nature and risk of counseling relationships in this PowerPoint and in future PowerPoints. Clients have the right to end the relationship at any time unless they're in a mandated program, and it's usually mandated by the court system. So let's start off by discussing confidentiality. Confidentiality means that clients are assured that whatever is discussed in counseling is private. It is a legal mandate. It's not merely an ethical construct, it is the law. Confidentiality is also vital for us to build trust. There are limits and exceptions to confidentiality. First, when harm could come to the client. Second, when harm could come to someone else. Prior to beginning the therapeutic relationship, it is important to share this information with the client. So examples when confidentiality can be quote-unquote broken include when someone plans to kill themselves, or if a child tells the counselor that a family member is sexually abusing them, keeping in mind that a child may not use those words. They may say something like they are being touched in a particular way that makes them uncomfortable. Someone may think about suicide, but they don't necessarily have a plan. They are not necessarily in imminent danger. It often comes down to a reasonable opinion based on professional experience and education. Many people have often thought about suicide, but they don't think about a plan. They don't gather up a quantity of pills, they don't buy poison, they merely come up with what it would be like for everyone in their world once they were gone. So it's more about sitting in their own misery. Whereas somebody who is serious about committing suicide has purchased a gun or razor blades, they have an actual plan. Most confidentiality laws allow professionals to consult with one another to elicit other expert opinions. So in a case where you may not be 100% sure about the situation, it's good to consult with a other person in your field to assess what they think about a particular client. Failure to report possible child abuse could in fact result in criminal charges against the behavioral health professional. If someone threatens to hurt someone else, the counselor has a duty to warn the police and the potential victim if they are named. So it is good to remind the client of confidentiality limitations. It's not that we don't want the client to keep things to themselves, but we also need to make sure they understand they can't just spout stuff off if they don't actually mean it. Not all criminal activity demands that the counselor break confidentiality. So if someone has cheated at work or cheated at school, if someone confesses to lying about something or having an affair, if they've engaged in petty crime like shoplifting, or if they engage in drug use. No disclosures required. Their behavior, yes, is illegal or unethical, immoral, but there's no one in imminent danger in this particular scenario, and that is the requirement. No one is in imminent danger. So let's move on to the skills that are needed for a behavioral health professional. Empathy is one of the most important, and this involves the ability and willingness to experience a client's beliefs, thoughts, and feelings through the client's eyes. Empathizing with unlikable clients, such as child abusers, is a very difficult task. However, it is vital to recognize that empathy does not mean you condone what they did, but you must try to see the world through their eyes. Understanding most abusive behavior is done out of pain helps to see unlikable, i.e. mandated clients, as broken human beings who have suffered themselves and become like those who hurt them. And again, you don't have to like your client. You don't have to see their perspective in terms of why they beat their child or abuse their child sexually. But you have to understand the cycle of violence or sexual abuse did not start with them necessarily, but is part of a long-term problem that this person has become part of. Another important skill is emotional maturity, which is the ability to be honest with oneself, the capacity to feel other emotions without losing oneself in those emotions, and keeping the focus on the client. This sounds like something most of us could manage, but it's very difficult, and it involves something called compartmentalization, where you literally take your emotional response to a situation, put it in a box, and leave it on your desk at the end of the day. We deal with a lot of traumatic situations, and if we internalize those emotions and take them home with us, we become stressed to the point where we can't do our jobs anymore. So we have to let those emotions stay at the job and move forward in our lives with this mature perspective that there has to be boundaries, and those boundaries have to be fixed so that we stay healthy for ourselves. Then we have cultural competence and diversity. It is essential that human services education includes cultural competence and cultural sensitivity. And in this program, you're going to get a lot of cultural information. Sometimes you'll feel as a little bit overwhelmed by it, but we live in a time where you can walk down the street and there's 100 different cultures that you could pass in a one block area. So counselors must be able to work with people of color, other minority populations, and being sensitive to their needs and recognizing their unique experiences is required when working in the behavioral health field. These skills, interventions, and techniques can be broadly applied in a generalist practice. When we think of cultural competencies, we might think exclusively of race, but we also have to think of religion, we have to think of gender, age, we also need to think of sexual orientation, we have to think of people with different cultural expectations. We think of people who come to the United States as, come to the United States to seek out better opportunities, but that doesn't mean that they're leaving their culture behind. So we have to practice what's called cultural pluralism and recognize that their culture is still very important to them, and we have to respect that. Boundary setting. I've already mentioned it briefly before, but human service professionals must establish boundaries in their lives to determine what is their responsibility to the client and what is not. It is the professional's job to empower clients to become more and more self-sufficient. They can never work harder than the client. The client's lives are their journey. They ultimately have free will, and they recognize people grow and change at different rates in their own way. We can't force a person to change. They have to make the change themselves. So a person who is an alcoholic and does not want to be sober, does not want to become sober, they relish their alcoholism as a badge of honor, there is very little anyone can do to help them. They are going to die of an alcohol-related disease. And again, the boundaries in place. We can do everything we can do to help them, but they must also help themselves. And that's the key. It has to be two people working together. It can never be one person doing all the work. So let's move on to conducting effective assessments. Tools for conducting effective assessments include the intake interview, identified problems, and a history of mental health services. All of these things come together, and what that requires is something called psychosocial skills. This is also a very important skill set for behavioral health professionals. They assist in the process of assessing the problems a client is experiencing. These skills include patience, active listening, and good observation skills. If you don't have them, these are skills that you can learn. These aren't necessarily skills that you're born with. Just sitting at a mall, for example, in the food court and observing people, watching interaction, seeing how people interact with one another, and just observing will help you develop these skill sets. Another option for assessment is developing a family genogram, and this provides a structured way to obtain a family history, helping the practitioner and client understand family dynamics affecting the client. For the vast majority of us, the first 5 to 7 years, we are primarily influenced by our immediate family. Mom, dad, our siblings, and any other close family that tends to surround us. When we move on to elementary, middle, and high school, we tend to then be influenced less and less by our family and more by our peer groups. However, so much of our personality is developed by age 7 that looking at the family genogram allows us to see how certain personality traits and relationships have developed in a particular person. So, based on the family systems theory, with the premise that relationship patterns amongst family members are transmitted from one generation to the next. So we see certain patterns that go from mom and dad down to the kids, down to the grandkids. The goal for achieving positive well-being is to find the balance between achieving personal autonomy and individuation while appropriate closeness with one's family system. So it's not about saying goodbye to mom and dad. It's about finding one's individual sense of identity while still maintaining a sense of family unity. We have to be able to be both. We cannot be that one person. We have to have multiple facets to our personality. And this is a good way of helping a client develop those. We can also do psychological inventories, and these are designed to assess depression, anxiety, social functioning, personality styles. The pictogram up at the top on the right is a Rorschach test, and that is when you are shown a particular picture. It's an ink blot, and you are to identify what you see. And then the psychologist will assess, based on your answers, where you are in terms of mood and personality. Another option for assessment resources is your clinical diagnoses. Behavioral health professionals use the DSM-5 to diagnose the mental and emotional disorders of their clients. The DSM-5 is the Diagnostic and Statistical Manual of Mental Disorders, 5th edition, and it is the industry standard to assess mental health disorders. An important distinction about this diagnostic system is that the DSM uses criteria based on symptoms, not the cause or the origin of the disorder. So this is a diagnostic tool. It's not a necessarily why does this person have this disorder. So it's not as functional in terms of helping the person identify why they may have developed a personality disorder or depression, but it can help identify what the disorder is. The DSM is used less among human service professionals than other mental health disciplines because the human service profession is based on the empowerment theory, where clients are encouraged to develop the skills to help themselves. So let's review the difference between case management and direct practice. Direct practice is more of the client's psychological growth and the development of emotional insights and personal growth, whereas the goal of case management is a method of providing services and coordinating those services with other systems impacting the life of the client. So, for example, identifying the community resources the client needs, coordinating the delivery of those services, and then coordinating service plans with the other services and service providers that the client needs. So you're really, coordinating and managing a series of moving parts, and it requires a lot of organization and interpersonal skills. So it's not just meet with the client, be done. There's a lot of moving parts that make it a dynamic, exciting career. So what exactly is the role of a behavioral health professional? You can think of it in the way of a farmer. In the same way a farmer cultivates his crops, a behavioral health professional cultivates their clients. They plant the seeds for future growth. They help the clients do productive work after the seeds have been planted. And ultimately, when the clients have achieved their goals, they develop self-efficacy, which is the realization that they can get their own stuff done, become self-sufficient. And ultimately, that's the goal. So, when we think of a generalist practice, we like to think of the concept of direct practice techniques. And these are basic techniques involved in a generalist practice that apply in a broad way to most counseling and intervention situations. So, for example, with a task-centered approach, an intervention strategy developed by the School of Social Services, which helps clients who feel overwhelmed to respond to the challenges of various psychosocial problems. So you have a client who feels overwhelmed by their anxiety, or they have issues with depression, and combine that with issues at home with their family, with their kids. Treatment is then focused on solving the problem by defining the problem and developing goals that allow the client's problems to be broken down into smaller and more easily manageable parts. Additional goals include assisting clients with emotional regulation, helping them when they feel overwhelmed, how to manage those emotions, because we all feel overwhelmed occasionally, and this is the opportunity for them to learn coping skills. Developing a better social support network. Most of us don't realize that there's always somebody out there who can provide help. And lastly, advocating for our clients. This is a job that requires us to be the hero for somebody else. And it is the type of job that at the end of the day, you made a huge difference in someone's life. And that is what makes it such an awesome career field to get into. So if you have any questions, please feel free to text or email. Otherwise, have a fantastic day. Thank you.